Hello, my name is Katie Weber with the Indiana Complex Care Coordination Collaborative at Indiana University School of Medicine. I am here to offer ways to accommodate health education for individuals who need special assistance. In particular, I want to talk about stoplight action plans. Common chronic diseases tend to occur more often in persons with intellectual and developmental disabilities, or IDD. This population tends to be high utilizers of emergency care for poor control of their chronic disease. It is important to consider how to provide your patients and their caregivers with information that will facilitate their self-care. Good medication reconciliation is always important and ideally should be part of every visit. Teaching about self-management of steady state, flares, and emergencies of known chronic diseases are also important. Stoplight action plans are a good visual tool to communicate with your patients with IDD and their caregivers to provide guidance for self-care. The following goes through how you might go through a stoplight action plan with a patient with intellectual and developmental disabilities.
Melanie, we've been talking a lot about constipation, and I want to show you this stoplight action plan because I think it might help with managing this at home.
Okay.
And I want you to notice that there are 3 colors on this page. There's the green light zone, the yellow light zone, and the red light zone. Tell me what green light means to you.
Good to go.
Good to go, perfect. So that's exactly what green light means, that I'm in a good to go state. And what does yellow light mean?
Slow down, maybe some problems on the way.
Excellent. Slow down, pay attention, be careful. So we're going to talk about if your good to go state changes,
Okay.
how do you know what that feels like and what to do about that?
Okay.
And then what does red light mean?
Stop.
Yep. So stop.
Emergency.
You got to do something different. Exactly. So those are the 3 different zones of an action plan, okay?
Okay.
And in each one, it first tells us, like, what's our goal? And you remember when we were talking about constipation that we said that going soft and easy at least every 2 days was the goal we set for you. Mm-hmm. And there's a number of things you're going to do to help make that happen. You have a medicine you can use, but I want you to remember that it's not just the medicine that fixes this, right? Mm-hmm. So number 1, we talked a little bit about fiber in your diet. Remember, we talked about whole grains and fruits and veggies. Mm-hmm. So how much of those you have is the first thing you're going to work on.
Okay.
The second thing is how you stay hydrated, right? Mm-hmm. And what are you doing to drink enough liquids now?
Using my water bottle to gauge.
Perfect. And keep active, because that keeps your colon going. Mm-hmm. And then you have a treatment plan, and I think you picked to use prune juice, right? Mm-hmm. And so you're going to use your prune juice a couple times a week to help this all work. Mm-hmm. Great. Now, what if it's not working? So then if we're in the yellow zone, that means like maybe you skipped some days and didn't go, or the poop's getting bigger or harder, or it hurts when you go. All of those might be times when you say, uh-oh, I'm not in the green zone anymore, I'm in the yellow zone. Okay. And the rules for the yellow zone are do more of anything from the green zone.
Okay.
So you could do more fiber, or more liquids, or be more active, or change how much of your colon medicine, the prune juice, you're taking. Okay? And we wrote a little bit more information about that out here, about how much more you might take.
Okay.
And then in the red zone, this is like you haven't gone to the bathroom for 4 days, 5 days, and your stomach's starting to feel swollen and maybe even starts hurting, and you don't know what to do. So what you do in that zone is you figure out who you're supposed to call. That's me in this circumstance. Mm-hmm. And then what do you do while you're waiting for an answer? You might still take a double up dose of prune juice, or you have some senna at home. You might take that as well.
Okay.
And then if it's still not working and you start vomiting, or your pain is getting worse, that would be a time to just go to the hospital. And so you might even get somebody to drive you there. If no one was available to drive you there, you'd call 911 to get an ambulance.
Okay.
So that's now green zone, yellow zone, red zone. How does that feel for you?
Sounds pretty good.
And I think you should take this home, right? And where are you going to put this at home to help you?
I'm going to put it on my refrigerator.
I love this idea. Good job.
Teaching individuals with IDD requires adjustment in typical communication style. Health professionals often talk at a 12th grade literacy level or higher. Think about the New York Times or the Wall Street Journal as examples of high literacy communication. Most patients actually prefer 6th grade level information, like what you would read in People magazine. Sentence length and syllables per word both contribute to the determination of reading levels. Roughly 14 words per sentence and 1.4 syllables on average per word is about 6th grade reading level. Persons with IDD do better with even easier to read information that is 3rd to 4th grade level, such as in highlights for children. 8-word sentences and an average of 1.3 syllables per word is about 4th grade level. As you provide or develop stoplight action plans and other written information for persons with IDD, review the literacy level and make sure the sentences are short and words are mostly 1 to 2 syllables. Do not use 3-syllable words if possible. Written information that is attractive to the eye and simple in layout is more likely to be used than information with many words and no visuals. For example, the constipation action plan used in this example is written at a 4.5 grade level and has layout and visuals that make the information easy to navigate. In comparison, this constipation action plan from Pediatric Health Network has wonderful information, but is written at a 13.1 grade level and would be more appropriate for a high literacy parent. Our 4ourhealth.org website has standard stoplight action plans for many chronic illnesses that have been vetted for lower literacy. We also have a blank template for less common conditions that would still benefit from a clear summary of the treatment plan in an action plan format. We encourage you to try using action plans with your patients and then verify if their self-care improves over time. Thank you for watching. To assist your patients in using an action plan, you can refer them to the partner video at 4ourhealth.org.